in order to encourage the students of the college as well as the teachers to take part in the COVID vaccination program organized by the government of India. Our speaker for today's program is Dr. Laloo, District Immunization of West Khasi Hills. Before we begin this program, we request Dr. G. Lyngdoh, Coordinator, IQAC, to kindly give us the welcome speech.
Thank you so much, Ms. Monica. On behalf of the principal, the vice principals, and the entire Synod College family, I want to welcome each and every one of you to this online talk, which is organized by the Department of Sociology, Synod College, in partnership with the State Health Services, represented by Dr. Laloo, District Immunization Officer, West Khasi Hills, Government of Meghalaya. Thank you so much, sir, for being a part of our program and for responding to our invitation. I think we are all agreed that we are living in unprecedented times in human history, made so by the onslaught of the coronavirus that has reshaped and redefined the face of the world. I say unprecedented because even though at various periods in the past, we have had our share of epidemics and life-threatening diseases, yet not so much at such a global level and at such an alarming pace as we observe today. And the fact that social media and technology has developed so much in the present times is both a bane and a blessing. A blessing because it has allowed us, access to more information and knowledge at the simple click of a button. But at the same time, it has become like a dangerous weapon, a double-edged sword, if you want to call it that, if it is not utilized responsibly. And lately, we have seen all kinds of information being put out on the internet relating to the coronavirus, which is the reality, which has become a part of our reality today. And there have been a lot of responsible information being put out, but there has also been misleading reports that has led to all kinds of misconceptions among the general public and fear, especially among the young people. So in order to play a small role as a college, in order to help in the dissemination of proper knowledge, of proper information, the college, under the initiative of the Department of Sociology, has taken up this challenge, this responsibility rather, to organize this awareness drive on COVID vaccination and its implication under the expertise and trained professional counsel of Dr. Laloo. And we hope that this will go a long way in dispelling fears and in clarifying doubts as our resource person address the issues raised, and hopefully it will lead us to a safer environment, a safer world, as we are made aware of the measures that can be taken to protect ourselves and our loved ones in the midst of this virus. So once again, on behalf of the college, I welcome all of you to this program, and I pray that it will be a truly beneficial one. Thank you so much, and God bless. I give this time back to Ms. Monica. Thank you.
Thank you, Ms. Lyngdoh, for the warm speech. And it is true that through social media, it has led to a lot of misinformation among the individuals and has created a lot of fear and panic. So therefore, we have amongst us today Dr. Laloo, who will be providing us with information and will also be clearing our doubts regarding the COVID vaccine. So sir, I would like to hand over the time to you.
Thank you, madam, for giving me the opportunity to be here to give some amount of clarification and sort of IEC to the students of your college regarding this COVID vaccination, which is happening in our state and in our country as a whole. As rightly said by Madam Teuso, there's been a lot of rumors and a lot of our community, especially here in Meghalaya, in East Khasi Hills in particular, since this vaccination started in the 16th of January, the number of persons, the number of people coming forward for the vaccination has not been very encouraging. And so having a forum like this to speak to young people regarding these vaccines is an opportunity I do not want to miss. So when we talk about these vaccines, let's first talk about the COVID disease, COVID-19 disease first. I think so. If you're all aware, there's been a huge surge in cases in the last I wouldn't even say a month. It's been for Meghalaya. It's been 3 weeks since we started getting this huge this exponential growth in cases in our state. So now, why is this happening? This is because it is a new strain of the virus, and then in public health we have something which we call the reproduction rate of a disease, known as the R0. So that basically means like the probability of a disease passing from one person to another. I mean, how many people a single person with the disease can infect. So when this disease in 2020, when this disease first came, when we first came to know about this disease, and the public health specialists and epidemiologists and other scientists, when they were calculating this reproduction rate, it was at 2. Basically, a single person who is carrying this disease can spread it to 2 people. But looking at the exponential growth now, scientists are coming up with a figure of 4 to 6, similar to the measles virus. So basically, this means that every positive patient can spread to a minimum. This is on an average. It's not like it's an average figure. So each person will spread to about 4 to 6 people. So that is a very, very high reproduction rate. So the government has basically 3 strategies to combat COVID-19. One of them, which is vaccination. So the first strategy is containment. So the recent directives by the government, whereby they're imposing lockdown, and then they have these vehicles have been put off the road, and then public transport has been affected. The selective opening and closure of shops, these are all part of that strategy of containment. Another strategy for containment is the establishment of these micro containment zones or containment zones once we get COVID positive patients in any locality or in any building or in any area. So these are the first step, and these are the steps which can be done if done effectively, can have a huge impact on the spread of the disease. Now, the second strategy for control of this spread of the disease is vaccination. Now, as we know, vaccination, like I told you, has been starting since the 16th of January 2021. and it's going on. It was in phases. Firstly, in phase 1, we had the vaccination of all healthcare workers. That includes all doctors, nurses, lab technicians, pharmacists, ashas, Anganwadi workers, so on and so forth. And then we also had the vaccination of frontline workers. Frontline workers are basically people who work with, who have a probability of coming into contact with a lot of people. So these are basically and who work in hazardous jobs. So these are basically like your police people, people from disaster management. A very important category of people which we vaccinated during this time were the sanitation workers. Then we also had members of the CCMPs. So since the start of Corona, we had developed these community COVID management teams in all localities. The members of those were vaccinated. Then we also vaccinated all taxi drivers. That is a very recent thing where we vaccinated taxi drivers and also all people who work in the banks and so on and so forth. Now, then we started community vaccination. Firstly, where we see about 59, sorry. Then after that, the government reduced the age to about 45. And then now we will be rolling out the vaccination for people above 18 years. So, like I told you, vaccination is one containment strategy, is one strategy to combat this this surge in this disease. And the last strategy, which is the most difficult, and we have seen, if containment and vaccination does not work, the chances that this last strategy will work are very, very slim. And that is treatment. India, our state as a whole, we have a shortage of all equipments, be it ventilators, be it oxygen cylinders, or even medicines. When this was way back in March 2020 when the coronavirus first started in Meghalaya. When we started the lockdown, and we had consultations with all private hospitals and so on and so forth, and government hospitals including Nigrams, and then Civil Hospital Shillong and all the other private hospitals. The whole of Meghalaya had only 17 ventilators. I mean, that's very, very sad. Yeah, now the government has stepped up on this, and we do have ventilators in all districts. But I'll tell you, in West Khasi where I work, we have 2 ventilators. So if there is a surge in cases, we wouldn't be able to. It'll be very difficult for the health system to handle this situation. So that's why the two other strategies, which is basically containment and vaccination, are so important. So I'll just tell you now something about this COVID vaccines. That is why we are having this talk. So this COVID vaccine, which we have there are many different types of COVID vaccines. Vaccines which have been developed. There is this the most common and the most widely used is the Kuvi vaccine, which is made by Serum Institute of India. So Serum Institute of India is a Pune-based company which was founded in 1964. Now, if you're all aware of, we have this what we call routine immunization. Now, routine immunization is basically the immunization of all children and all pregnant mothers who get their tetanus toxoid shots, and all children who get their pentavalent, measles, BCG shots. 70% of all these vaccines are made by Serum Institute of India. So it's a reputed company which has done a lot of work in the field of vaccine production and development. So now this vaccine is a viral vector vaccine. There are many different types of vaccines which can be developed. You have live vaccines, you have inactivated vaccines, you have attenuated vaccines. So this Covishield is a viral vector vaccine. The technology for making viral vector vaccines has been there since the 1990s, and knowing that in healthcare, developments in healthcare are very rapid. So since 1990, it's been a long time since people have been experimenting, have been trying out this vaccine. So it's a very safe vaccine. Then we also have these new vaccines which were developed in Western countries, like your Pfizer and Moderna. These are these RNA vaccines. These vaccines are very new in terms of technology. This is technology basically maybe from 2010, 2011. But we're not using those vaccines here in India. We're using the Covishield, which is the viral vector vaccine. Then we also have Covaxin. However, Covaxin is not being used in India. It's being used in India, but it's not being used in Meghalaya. We're using the Covishield vaccine. Now, basically, everyone who needs to get vaccinated will get 2 shots of this vaccine. They will be given on either arm. Could be your left, could be your right. So what the government says, it's your non-dominant arm, the arm which you do not use. So I'm a right-handed person. I took it in the left hand. You'll be given 2 shots of the dose IM. IM means intramuscular, and the minimum. What do you mean? The minimum time between these 2 doses will be 28 days. So as we've seen in recent times, because we've vaccinated crores of people here in India. So what we have noticed about this vaccine is like the immunogenicity or the efficacy. So I'll explain to you later what this efficacy and immunogenicity means. The efficacy and immunogenicity of this vaccine is better if the time between the 2 shots is approximately like 4 to 6 weeks. Okay, so around between the 28th to the 42nd day. So that's why now we are advising people to take the shots, to take the second shot in the 6th week. So now if you do miss your shots, say you miss your second shot and you don't take it within the 28 to 42 days, that's not a problem. You can still take it up to 3 months. So that's up to 90 days. But it would be advisable not to miss your second shot and to take it on the scheduled time. Okay. So now there are many questions regarding what are the side effects which you get from the vaccines. So from what we've seen, from what I've seen personally in West Khasi Hills, we've vaccinated around 20,000 people. In Meghalaya, we vaccinated around 1.5 lakh people, 1.6, sorry. So what we've seen is like you get the normal side effects which are common in all vaccines. So you have these side effects like fever. It could be high-grade fever. You can get fever. You can get body ache. You can get knee ache. You can get weakness, generalized weakness or malaise. You could get nausea. Some instances of vomiting. So these are the normal side effects which do occur after vaccination. Now these side effects are common to all vaccines. I mean, if there are any parents here in this group, so am I audible?
Yes, sir. Yes, sir.
If there are any parents here and if their children have received the BCG, which is the vaccine for tuberculosis or measles vaccine or pentavalent vaccine, you'll see that kids will have fever in the evening. So these are very common side effects. Of course, there are some uncommon side effects to this vaccine. During the development of this vaccine, during the trials of this vaccine, they have anticipated certain of these COVID vaccines, adverse events, as we call them, adverse events following immunization. The good thing is, like, we haven't reported any of those adverse events in Meghalaya. Now, you have certain, one of the most dangerous adverse events which can occur after vaccination is something called anaphylactic shock. Okay. Now, anaphylactic shock occurs when a person is allergic to any one of the ingredients or any one of the ingredients or the compounds which are contained in the vaccine. So usually what happens in anaphylactic shock is like it occurs very rapidly. It occurs within 10 to 15 minutes after a person is given the vaccination. He'll develop a rash at the vaccination site. Then he'll develop something which is known as angioedema. Angioedema will be like in your lips. This is known as a mucocutaneous junction. There'll be swelling of that. And the most dangerous is the swelling of larynx and your pharynx, basically your neck. So there's swelling, so people have difficulty in breathing, and that can lead to death. However, to combat this, and since we know it can occur, rarely it occurs, but it can occur. So in every vaccination session site, our ANMs, our vaccinators have been trained to administer 2 injections if this were to happen. One is adrenaline and another one is hydrocortisone. So these are, so basically what anaphylactic shock is an allergic reaction, a very severe allergic reaction to any or one of the compounds or one of the constituents of the vaccine. So since we know these are, it can happen, we have kept systems in place. Now with regards to vaccination, like you, I think so for, if most of you are students here, you'll definitely be under 45. And if you want to take the vaccine, you know you have to register online, right? So even for the, even for after vaccination, before you get your COVID certificate, your COVID vaccination certificate, everything is done through an app known as the Coven app. So in the app also, we have to report all these AFIs. And so these AFIs are taken into consideration, they're kept in a database, and that gives us information, not only for us to move forward in terms of these AFI prevention. So these are the steps which the government has taken. Not only the government, I would say all research facilities, all governmental or non-governmental institutions have taken to make sure that no untoward incidents occur after vaccination. Now, another thing regarding this vaccination is a very important question is like who are eligible and who are not eligible for vaccination. So as of now, pregnant women and women who are lactating women means women who are breastfeeding infants who are under 6 months of age. These 2 category of people are not eligible for the vaccine. Now, this isn't because the vaccine is dangerous or it causes any harm to these people. It's just because there has been no research done on pregnant women and lactating women. If we look at past data concerning other vaccines, we see that usually there are no being pregnant or lactating is not a contraindication for vaccination. But until this is a new vaccine, the government and other research bodies have asked that people who are pregnant or lactating, we withhold vaccination from them temporarily until further studies can be done. Now, what has happened is like it is already occurring in a lot of Western countries and even in America, where they are testing these vaccines in children more than 6 months of age. So after those studies are published, we will know about whether vaccines can be given or should not be given in pregnant and lactating mothers. Now, another category of people who should not take this vaccine are anyone who has any kind of bleeding disorders. So now, if a person has any kind of a bleeding disorder, it could be thrombocytopenia, it could be hemophilia, there are many types of diseases. They would already know they were having this kind of diseases. If you're a person who's walking up and down and you don't have these bleeding tendencies and you've never been to a doctor who's ever diagnosed you with these problems, then you probably are not having these diseases. But anyone who has hemophilia, then you've got this Christmas factor, deficiency of this Christmas factor in your blood, or you have hemophilia or idiopathic thrombocytopenic purpura, so on and so forth. These are people who should not take the vaccines. The reason why you do not take the vaccines is because people who have these bleeding disorders, they are not allowed to have any kind of injections, because like you give an injection, they could be hemorrhage in the site of injection, which can lead to a lot of problems. So these are the categories of people who are not given the vaccine. Now, regarding the efficacy, like I was telling you, I'll explain to you later what was the efficacy and immunogenicity of the vaccine. Efficacy is basically uh, the once you've taken the vaccine, what is the probability that you will contract COVID-19? Okay, like what is the probability that this vaccine will protect you against this disease? So from literature which has been published regarding Covishield, we see that any person who's given the first dose, the efficacy of the vaccine is 73%, which means that if 100 people were to get only one dose, 73% of them, 73 of them would be protected from the virus. Then the efficacy after the second dose. Now, why do we give two doses? Is because of this reason. The efficacy with one dose is 73%. The efficacy with a second dose goes up to 95%. Okay. Now, so people who've received, if 100 people in a room and 100 of them receive the vaccine, with one dose, 73 of them would be protected. With two doses, 95% of them would be protected. Now, what do we have to say about the remaining 5%? This is always, it does occur where people, because of their genetic makeup, because of the way their body is, they will not develop antibodies to this, or even if they do develop antibodies, these antibodies may not be sufficient to fight off a COVID infection. So that's what we call efficacy of the vaccine. Now, immunogenicity immunogenicity and efficacy are related in the sense where if the immunogenicity is high, then the efficacy will also be high. So from studies which have been done with this Covishield, we see that. So what is immunogenicity? Immunogenicity is the probability that this vaccine will develop antibodies in your body. So the immunogenicity of this vaccine from studies which have been done, and these studies have not been done only in India, they've been done in India, in Brazil, in South Africa, and in United Kingdom. So the immunogenicity of this vaccine with the first dose is around 96%. So immunogenicity is the probability that this vaccine will produce antibodies in your body, and with the second dose, it goes up to around 99%. So we see that this vaccine is effective, and we have systems in place to see to it that no untoward incidents occur following vaccination. Okay. Now, like what Madam Teso had said earlier, there's a lot of there's lots of misinformation, there's a lot of hearsay, there's a lot of rumors regarding vaccination and vaccines. So one of the most common rumors we've heard, especially because we've done this with a lot of college students, we've done this with people from other departments. So one question, which is again, it is a good question they ask, is like, how is it that you can develop a vaccine in just under a year? Now we have to remember that this coronavirus is a family of viruses. Okay. Now the official name for this COVID-19 is SARS-CoV-2. That means severe acute respiratory syndrome coronavirus 2. So if there is a coronavirus 2, there's a coronavirus 1. So this coronavirus 1 was the coronavirus which caused the SARS epidemic, I think so, during the early 2000s in Southeast Asia, okay, in Singapore and in Thailand. So that also was a coronavirus. Then we also had this Middle Eastern respiratory syndrome. This was one of the most fatal coronaviruses which circulated in the world. Thank God, we were able to. The world was able to control it. It had a fatality of 35%. So this Middle Eastern respiratory syndrome was also from the coronavirus family. Now, when developing vaccines, all these usually we will be targeting either the receptors, or they'll be using like what Moderna and Pfizer are doing. They're using the viral RNA to stimulate the body to produce antibodies. So studies on these other types of coronaviruses has been going on since the 1990s. So if people say that the development of this vaccine has occurred only within this year, it is factually incorrect. because research on this on this family of viruses has been happening for the last 20, 25, 30 years. So that's why we should not give in to rumors such as this, which says that there is a new vaccine and it has this, it has that, so on and so forth. Now, another rumor, which I think so, this rumor is not very prevalent in urban areas, but it's very prevalent in rural areas. What they say is that this vaccine is being used for population control. It's going to cause infertility in women. It's going to cause sterility in men, so on and so forth. I'll tell you, this vaccine is not the first which has been accused of all these things. I'll tell you, since the 1990s, when we rolled out the polio vaccine, and now India has been polio free for the last 10 years. When we were rolling out the polio vaccines, one of the biggest reasons for people not taking the vaccine, resistance to this vaccine, one of the reasons was that we had these rumors and these misinformation that these rumors caused this, that these vaccines caused this. But then, if that was the case, India's population would not be where it is today if it does cause infertility and sterility, because the polio vaccine we were been using since the 1990s. And I guess no government or no health professional or no bureaucrat or no minister will be so cynical so as to use such a method, such a system, primarily for population control. I mean, we have other systems for. We have the family welfare program, which has been running for many years and which has been very successful. So these are all hearsay and these are all conjectures which we should not listen to. So that's it. What I would like to say about these. We should not listen to these rumors which circulate especially in social media. Now, regarding there's a question here. Okay, fine, it's gone. I will answer questions later. Now, regarding for the students who are here who are more than 18 years, who are between 18 to 45. See, what is happening now is we are having a shortage of vaccines. So that's why the government, to prevent what you call it, wastage of vaccines, we have to do online registration for all beneficiaries who want vaccination. Now, why wastage of vaccines occur is because these vaccines, we have to transport them in very specific conditions. Once vaccines are opened, they have to be used within 4 hours. This is a very strict protocol which has been given by the national body for vaccination in COVID-19, and it's same for other vaccines like BCG or measles or Japanese encephalitis. Once we open the vaccines, these vaccines have to be used within 4 hours. If we do not get any beneficiaries within those 4 hours, then the vaccines will have to be discarded. So that's why the government has instructed that to prevent this wastage of such a precious vaccine, especially at a time when we are having vaccine shortages. So that's why they have mandated that all people in this age group should pre-register. Now, as per the information which was given to us, vaccines for this particular age group will not be available immediately. It will not be available immediately because we're having a difficult time procuring the vaccines. Apparently, the government is having a difficult time procuring the vaccines. However, vaccination for all people above 45 and all people with comorbidities will still continue. Okay. Now, regarding comorbidities, yes, I forgot to tell you about this. Regarding comorbidities, now comorbidities are basically any disease, any chronic disease which a person is currently suffering from. So the question is, a lot of people ask this question: should people with comorbidities take this vaccine? With a thumping yes, because people with comorbidities, again, we've seen from data last year, people with comorbidities. Now, comorbidities are what? People who have hypertension, people who have diabetes, that is sugar problems, people who have chronic kidney disease, people who have any kind of liver disease, people who have any kind of lung disease, people who have any kind of heart disease, people who have cancers. These people are given a priority when it comes to vaccination, because it was seen from data, not only in India, but internationally, that people who suffer from these comorbidities, once they get the disease, the probability that they will die is very, very, very high. So that's why the government has mandated that, again, I'll tell you, not only the government and research bodies have mandated that these people who have comorbidities should be given a preference when it comes to vaccination. So regarding vaccination, again, in Meghalaya, in East Khasi Hills in particular, all PHCs, these are primary health centers, community health centers, and hospitals under the government sector, they offer this vaccine free of cost to people who are over 45 and healthcare workers and frontline workers. And these sessions are usually opened on a daily basis, probably from 9 to 5. And in public and in private hospitals like say Nazareth, Bethany, and so on, Woodlands, you can get the vaccination, but the government has allowed these hospitals to charge a service charge of 250 rupees, out of which 100 rupees will be their service charges and 150 which has to be deposited back to the government as the cost of the vaccine. So these are the few things I wanted to say regarding this vaccine. If you have any questions, I'd be most welcome. Thank you. Okay, let me see the questions. I saw some questions.
Thank you, Dr. Laloo, for a very comprehensive speech on the virus as well as the COVID vaccine. You have cleared most of our doubts, fears, and misconceptions about the vaccine. We now continue this interactive session with the participants. I request any of the participants to ask questions to Dr. Laloo to kindly do so at this time.
Okay, I have here two questions, one from Adelbert Majau. Can old people with different skin allergies give the vaccine directly or after certain tests? So there are no tests which are indicated for giving the vaccines. However, if you are taking medicines from any particular doctor, this is what we all advise. If you are taking medicines from a particular doctor, say you're taking medicines from a doctor who's from a medicine specialist who's in Bethany, it would be advisable before you take the vaccine to call him up and seek his advice if taking the vaccine is beneficial or not beneficial for you. Because for me, I wouldn't know what medicines you're taking or what disease you're suffering from, so I wouldn't be able to make that call. So it'll be best if you were to call your own treating physician. Okay. Now the next question from Amy Pika Marbanyang: can stroke patients take the vaccine? Yes. Again, cardiovascular accident or strokes, these are considered chronic diseases, and people who have these kind of who've had strokes should be, if they've had strokes, means they'll probably be having hypertension or they'll be probably having diabetes. So these people should take the vaccine. Then the next question is from Ferry Corridor Lyngdoh. Is it true that Covishield helps only double mutant, whereas Coven helps both double mutant and triple mutant strain? See, now these are no research has been done on this. As of now, they're saying the Covaxin vaccine helps with the triple mutant strain, but again, this is all conjecture. I wouldn't say it's rumors, it's conjecture. People are just jumping to conclusions. We cannot come to these conclusions until data from the field comes back. And like this new strain, this surge in cases in India has happened only maybe a month, 45 days, 2 months at the most. So there'll be too less of time to come to any conclusions, especially in our state where we've had a surge only from the 6th of April. It'll be very difficult to come to these conclusions as of now. Now, another question from Maria Ranglong. What is the difference between who are vaccinated and who are not vaccinated if they're affected by coronavirus? Okay, very good question. Now, as I was telling you, even vaccinated people, the chances they will get the disease is lower, but it does not mean they will not get the disease. There is still a probability that they'll get the disease. However, once you're vaccinated, the probability that that disease will turn into a severe or serious illness is very, very slim. So in when it comes to treatment of people who suffer from COVID-19, we have segregated them into category A, B, C, D, where category C and D are the most severe, where they require oxygen and they require ventilators. And this data has come back from from even European countries and even from India, that people who are vaccinated usually do not progress to type C or type D. At the most, they will get some asymptomatic illness or minor flu-like symptoms. So that is why it's important to get vaccinated, because it prevents the severe forms of this disease from manifesting. So next from Vishal Das, after taking the vaccine, will we have any temporary symptoms? Like we used to hear that allopathic medicines always have symptoms, or is it just a myth? Now I have talked about AFI, like adverse events following immunization. Now, following any immunization, there will be some temporary symptoms. Like I told you, there'll be fever, there'll be malaise, there will be body ache, there'll be muscle aches. Some people have vomiting. These are temporary signs, temporary signs and symptoms which will subside. Usually, what we advise after vaccination, we always give the phone number of the vaccinating nurse or of the medical officer. And if people have any of these symptoms, we advise them to take paracetamol. And usually, there are no. Usually, they get well. Like yesterday, one of my friends, he took the vaccine, and then this morning he called me up. He said he had high fever, so I told him to take paracetamol, and he's probably okay right now. No, so symptoms are usually temporary. Okay. Now another question from P1 Thama. Why do we need to be given 2 doses of vaccine instead of a single this regarding the efficacy 73% with the and so that's why we have to take 2 doses. If you notice, most vaccinations will require 2 or 3 doses. With measles, we give 2 doses. With JE, we give 2 doses. With pentavalent, we give 3 doses. With OPV, which is oral polio vaccine, we give multiple doses. And with IPV, we give 2 doses. Rotavirus, we give 3 doses. So most vaccines work this way. We always have to give a booster dose. Okay. Now, next question by okay. Telling you the efficacy of the vaccine, the probability, I mean, like, is with 2 doses, 95%. So 95% of the people who take the vaccine will be protected against the disease. The remaining 5%, that is because of their immune system or their inherently how their body is, even after they receive the 2 shots, will not be protected. However, if 95% of the population is protected against disease, the probability that those 5% will get the disease is very, very slim, because then something called herd immunity kicks in. You should read about herd immunity. Herd immunity is something which has worked very well with measles. If we vaccinate just 95% of children, then the remaining 5% of children who cannot be vaccinated because of diseases, like because they might be having some terminal diseases like leukemias, so on and so forth, they also do not get the disease because the disease cannot spread. Okay. So, so that is from that was that question. Now, so what happens if you are vaccinated and exposed to COVID? So, if you're when you're vaccinated exposed with Only 5%. You okay. Thank you, Adelbert. What is the cause after taking the vaccine 5? What is the cause? I don't understand this question. What is the cause after taking the vaccine 5 or 10 years later? So anyway, fine. Thank you so much, doctor, for the clarification. If majority of people are supposed to take the vaccine, then who should not get the COVID-19 vaccine? If there is a specific age group that should not be taking the vaccine, like 10 years or so on. So a question from Lyngdoh, I have already said, people who are women who are pregnant or who are lactating, these women should not take the vaccination because there's no research which has been done on pregnant women and lactating women. And finally, and secondly, any people who have any forms of any kind of bleeding disorders, these people should not take the vaccine. Thank you so much. Okay, if a person who is vaccinated and get positive result for the virus, what is the chance of spreading the virus to others compared to those who have not given the vaccine? Now, if you've gotten the vaccine and you still get the disease, the probability that you will spread the disease will be equal. That is why, even after vaccination, we ask people to still follow those 4 things which you have to do to prevent the spread of the disease. Number 1 is you have to still wear masks, you still have to do social distancing, you still have to do frequent hand washing, and finally, you have to have respiratory etiquette. Respiratory etiquette means that is something which is not usually mentioned, but which is very important. We should see to it, especially in our society where we eat a lot of kwai, no spitting randomly here and there, because that again can cause a lot of can spread the disease. Then if you're going to cough or you're going to sneeze, you use your hanky or you sneeze or cough into your elbow. And after sneezing and coughing into your hanky or into your hands, you should wash your hands with soap and water or with what you call this, with sanitizers. Okay. Okay. Now next one. I can't answer. If someone is left under medication, is still under medication, can he still get vaccinated? So like I told you, if someone is under medication, the best thing to do is to call up the doctor who's treating you, and that doctor will be able to advise you accordingly, whether they can be vaccinated or they should not be vaccinated. Okay, here's another question. What are the expected long-term side effects of the vaccination? Now, usually there will be no long-term with all diseases. Okay, like since again this we've started vaccinating against COVID-19 only recently, so that kind of data will not be available. But if we have to look at from past vaccinations using the measles, pentavalent, OPV, so on and so forth, there are usually no long-term side effects of the vaccination. I guess the only long-term side effect of vaccination is that you don't die early. I guess you live longer. So if that can be taken as a side effect, but there are usually no long-term side effects to vaccinations. Okay, I know why you're asking these questions. There are a lot of these people on social media. Like I've seen like those people like what's the name of that fellow who said that it causes autism, Andrew Wakefield and all. Now these people, you have to understand that when those studies were published, those studies have been debunked. Okay, there are no long-term side effects to these diseases. Okay, to these vaccinations. So, how long is this vaccine? Like I was telling you, we are not very sure. It could be between 1 to 3 years. Again, we are using this data from. Just hold on 1 minute. Just hold on 1 minute. Okay, as I was saying, long-term side effects. How long is this vaccine lasts for after we have been, like I said, 1 to 3 years? In case we have some side effects after getting the vaccine, then what should we do? See, what happens is usually at the vaccination session site, the nurse who is vaccinating you will probably give her number, or the number of the medical officer will be there. And then if you have any side effects, you can always call them up and explain to them, and they will guide you accordingly. Okay. Is there any effect after taking of the vaccination? Because some people in my area told me that after they had taken the vaccine, they were feeling very weak. Yes, this is a very, very common side effect of this vaccine. But again, it's a temporary side effect. For me personally, also after I took my first shot, the evening after I took my first shot, by around 9 o'clock, I was fast asleep. You feel there's this feeling of you feel lethargic. I felt lethargic, but that is an anticipated adverse event of this vaccination. So these are anticipated. We've anticipated that these things will occur because these are normal things to occur post vaccination. You get fever, you feel lethargic, you get muscle ache, you get your joints will ache. These are normal things which occur after vaccination. Okay. Is it true that the weakened version of the virus used in the vaccine is not an actual complete structure of the virus, but is genetically engineered because of the fact that the virus cannot be fully isolated? Now, when we make vaccines, okay, vaccines basically, I was telling you, there are many, many different ways of making vaccines. So you can have number one is an inactivated vaccine. So an example of this would be your inactivated. I don't think so we use any more of those vaccines inactivated. No, wait. BCG is a live vaccine, inactivated. Yeah, it will be the old form of polio, the polio vaccine. So basically, the virus is totally killed, and then parts of it are in there. Okay. Then you have the those are attenuated. Then that's inactivated. Then you have attenuated. Attenuated vaccines are vaccines in which the microorganism, the virus or the bacteria, is weakened by using any forms, by using any kind of chemicals. Okay. Now for this Covishield, I will tell you is a viral vector vaccine. Now, what is a viral vector vaccine? A viral vector is basically you take a subunit of this vaccine, which is usually the receptor proteins which are present on the surface of the surface of the surface of the virus. Okay, and then you insert it into a vector. Now, a vector in this case will be an adenovirus. Now, they use this chimpanzee adenovirus. Now, why do we use chimpanzee adenovirus? Because this chimpanzee adenovirus cannot cause active disease, cannot cause any disease in human beings. So this adenovirus is used as a vector. A vector means a transport agent to take that subunit of the vaccine into the human cell and cause an immune reaction. Okay, and then the last but not the least is the new form of vaccination, which is your Pfizer vaccines, where they use messenger RNA. So this messenger RNA is carried again into the cells, and then it's replicated there. But that messenger RNA, please do not be confused, will be destroyed by the body once the immune reaction has occurred. Okay. Now, many questions here. No, I've lost track because there's so many questions. Okay. Yes. Okay. Now, which indigenous vaccine is more effective, Covaxin or Covishield? Now, since we're using Covishield here, and I am more aware of Covishield, like I was telling you, the efficacy of the vaccine is 73% after the first dose and 95% after the second dose. Covaxin initially had a lot of bad publicity because when they were giving the vaccine, they rolled out the vaccine before trials were completed. So it had a lot of bad publicity, but Covaxin is equally effective as Covishield. Now Covaxin it's done with all its trials, and it's showing to be an equally effective vaccine. Okay, next question. If a person already had COVID and recovered, does the person still need to get vaccinated? Yes, very, very good question. Now, if a person gets the disease, okay, then his body is fighting the disease. Okay. Now, usually when anybody gets a disease, the immune system is more compromised. Okay. Now, if the immune system is more compromised, yeah, after you get COVID, your body will develop antibodies. But during the time when you're suffering from active COVID, okay, and those antibodies are being created, your immunity is less, right? Because you're suffering from a disease. So the number of antibodies which is formed at the time when you're suffering from an active disease will be much, much lesser than when you take a vaccine. Because when you take a vaccine, your body is at the most healthy, is at the most robust. So yeah, it can create more antibodies. It can create not better antibodies, because they can't be. There's no question of being better antibodies, but it can create more antibodies. So that's why it's always, even after you've suffered from COVID-19, it is advisable to take the vaccine. Okay. Okay, so we've answered that. Without, see, now vaccination, again, it depends. If you want to take the consultation of any medical officer, you can always go and ask him, and ask him regarding whatever, what do you call it, whatever fears or whatever misapprehensions you may have regarding the vaccine. There's no problem. And like I was telling you, if you are suffering from any kind of disease, or you are taking any kind of medication, it'll be best to ask your own treating physician whether you can take the vaccine or not. Okay. Okay. Any other questions? Okay, what is the difference between the first and second dose of the vaccine? I think so I answered that. It's about the efficacy, 73 and 75, 95%. What is the gap between 2 doses of COVID vaccine? What happens if you don't get these second COVID shot? So, like I was telling you, the minimum gap between 2 doses of COVID is 28 days. That's the minimum. And the maximum can stretch up to 3 months, 4 to 6 weeks. So between the best time to get your COVID. What happens if you don't get these second COVID shot? If you don't get the second COVID shot, the probability that, like I told you, the efficacy of the vaccine is 73 and 95. 73% after the first dose, 95% after the second dose. So if you don't get the second shot, the probability that you would have developed antibodies will be much lower than if you had gotten the second shot. Okay. Has not yet fully completed, but that is approved for emergency use. No, see, now when you're talking about clinical trials, okay, there's so many types of clinical trials. There's the stage 1, stage 2, stage 3, and stage 4. Now, no government or no research institution will allow any kind of use of any drugs, so on and so forth, until they've completed minimum their third stage trials. Okay, so initially, that's why I was telling you about Covaxin. Covaxin, when it first rolled out, it was still during the trial phase. That's why those days, for people who were taking Covaxin, they had to sign a consent form. But now those trials have all been completed. So now you don't have to consign a consent form anymore. It's fully it's known to work fully well. The Covaxin. Okay. So I guess there are no more questions.
So, on her behalf, I would like, first of all, to thank you, the principal of the college, Dr. R.M. Lyngdoh, as well as coordinator IQAC, Dr. Mrs. G. Lyngdoh, for allowing us to organize this program. And we also thank Dr. Laloo for sparing his time in providing us information regarding the COVID vaccine as well as the coronavirus. And we also thank the students, the teachers of the college for being part of this online interactive program. Thank you.
Bye.
Thank you, Doctor.
Thank you, sir.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.